Welcome back to CBS Saturday Morning. We begin this half hour with a growing problem in rural America. The latest census report finds that 60 million Americans, nearly 1 in 5, live in rural areas. And according to the Centers for Disease Control, they tend to be older, sicker, and poorer than the average American. Now they're at even greater risk. A report that finds there are not enough ambulances to help in an emergency. CBS News transportation correspondent Errol Barnett has the story.
In southwest Wyoming, there are only 4 ambulances for an area the size of Connecticut, 10,000 square miles. And Ron Gotti, owner of Sweetwater Medics in Rock Springs, tirelessly serves the 42,000 people who live there.
We do this because we feel a greater call to provide for mankind.
But having an emergency here gives new meaning to the word.
One of our biggest stress factors is the distance we travel, the distance we transport patients.
Brian Everlith is one of 12 on Sweetwater's full-time EMT crew.
I've transported critically ill patients back from the scene for an hour and a half, especially if it's snowing. It just takes a long time to get there. And, I'm going hollering at my driver saying he's getting worse, and the driver is hollering back, the roads are getting worse too, and I had to slow down.
When a call comes in, there's no telling how long it will take to get to the one hospital in the county with a 24/7 emergency room.
We have 2 major interstates that run through the state of Wyoming, and those traveling along those 100-mile gaps in the state of Wyoming have no idea of the crisis that emergency medical services is in.
Rural ambulance service is in its own emergency, according to a study from the Rural Policy Institute. It found long distances and challenging terrain prolong emergency response times. There's not enough money to make ambulance service viable, and there's a lack of regional EMS plans to coordinate services.
A lack of EMS has a direct impact on the life expectancy of these rural residents.
Based in Washington, D.C., Alan Morgan is executive director of the National Rural Health Association.
When you say this could be a contributing factor to the mortality rate worsening in rural areas, it's a really shocking statement.
Since 1980, while we've seen increased life expectancy among urban populations, we've seen declining life expectancy among rural populations. And not having access to timely EMS services has a direct impact on your chances of survival.
Compounding the problem is the fact that 39 states, Wyoming among them, do not designate ambulance service as essential, which means government support available to other essential services like police and fire services are not available for ambulances.
We are viewed not as healthcare providers, but as transportation providers. We're not just an expensive taxi. We deliver life-saving skills. I have critical care paramedics that do miraculous things.
The stresses on rural ambulance providers is coming as aging baby boomers need them most. Nearly 1/3 of the nation's rural medical services were found to be in immediate operational jeopardy. In Penrose, Colorado, ambulance service was suspended in July, with the fire department posting, "The community cannot assume that an ambulance will be available for a call to service." In Montana, a Department of Public Health and Human Services report found 34% of ambulances occasionally cannot respond to a call. 10 Wyoming ambulance companies are on the verge of closing down, including Ron Gotti's.
The cardiac monitors that we have to buy are $30,000 a piece. It's an expensive place to get into. There's no profit margins.
The problem with rural EMS is it's a numbers game, and for rural America, the numbers just don't add up.
What role do insurance companies play?
Yeah, unfortunately, for a lot of these rural communities, it comes down to the payment issue. It's so very important for insurance companies to step up and do their due part to ensure access to care for rural Americans when it comes to EMS services.
We're only reimbursed if we're transporting people. So if I go out and I help you and I wrap up your wounds and I take care of you and you tell me I don't want to go to the hospital, then we don't make any money.
The Sweetwater Ambulance Company remains in business thanks to support from the county's supervisors, but that lasts 1 more year. So very soon there could be no ambulance service around the Rock Springs, Wyoming area.
They go and they risk their lives, and they do things that other people won't or can't do to make the difference for a human life. Well, we need a hero. We need heroes now.
For CBS Saturday Morning, Errol Barnett, Washington.
It's hard to imagine ambulance services not being designated as essential,
right,
as they are or not in some
Four
states.
ambulances for every 10,000
It's
square
insane.
miles. It's crazy.
Yeah, with that, he said it's a numbers game, but we're talking about lives.
Yeah.
That should matter first.
One, and the other one, 100-mile gaps
Yeah.
in between. It's just frightening.